Good morning, good afternoon, and good evening, everyone. Welcome back to our Patient Safety Project YouTube channel. And I'm glad to be at Naguru National Referral Hospital. Today we have the PHA. She will introduce herself.
Thank you very much. My name is Regina Mugisa and I'm the Principal Hospital Administrator here at Naguru National Referral Hospital.
Thank you very much. Thanks, Regina, for having us. And today I have my first question as, how is Naguru Hospital incorporating in their financial strategy? How are they incorporating and allocating funds for the 5S-KAIZEN activities at Naguru National Hospital?
Okay, thank you very much. In understanding how we allocate resources and budgeting for the 5S-KAIZEN activities, it's also important to know how actually 5S, IPC, and the CQI patient safety activities are interlinked. Because when we look at 5S, this is the mechanism for improving safety by incorporating the safety into the 5S events. And when we look at the IPC, is unique in the field of patient safety and quality of care. And then the continuous quality improvement, this is a progressive and incremental improvement of processes and systems in safety and patient care. And while patient care itself is a discipline that emphasizes patient safety in the healthcare setting. So how we do incorporate this is during the strategic planning of the hospital, the strategic objectives, the outputs, and the activities of the departments that are going to implement actually integrate IPC, 5S, and patient safety activities. And then secondly, we also make consideration in the work improvement processes of the hospital when we are budgeting for the hospital. We also consider what exactly is going to provide a conducive environment for both our patients and also the healthcare providers. So therefore, we provide priorities which ensure that there is 5S, IPC, and patient safety and other Kaizen activities in place. For example, we emphasize that there is electricity and water at all times. We also budget for cleaning services. The cleaning service provider ensures that the hospital is clean, more especially like the washrooms and the hand washing facilities, just to mention a few. They also team up with the unit in charges to ensure that all the departments where the services are being provided are all clean. And also the cleaning ensures that there is waste segregation, and therefore the 5S and IPC activities are implemented through the funds that are provided for cleaning services. We also provide funds for the storage of various things like the drugs and sundries, and at the end of the day it is easy for the healthcare providers to access some of these things when they are providing the service, and therefore there is safety for the patient. We also provide things like the stationery and printing materials in our daily budget. So we do not differentiate that this is stationery for IPC and this is stationery for other things in the hospital. We integrate all when we are procuring the stationery. And then also, when we are having the meetings, we also ensure that IPC and 5S activities are discussed. So we provide refreshments for these meetings. We also provide trainings which are marked together for 5S activities and the IPC and the safety activities. We integrate all during the budgeting for the trainings. We also provide the tapes and all other things for color coding and so on, waste bins, and all these things ensure safety and the IPC and patient safety. Yes, we also budget for support supervisions to monitor and see that all the departments are actually implementing the 5S and IPC activities. This support supervision also includes other activities in the hospital. We also budget for rewards and sanctions.
That's nice.
Yes, we budget for it, and these are planned for. Here we provide like a goat or a cow, so the staff are able to actually celebrate their achievements in 5S and IPC activities. We also seek for funding from humanitarian people, those who are able to support us in providing those things that we need for IPC and 5S, as we know very well that with budgeting, funds are always inadequate. Thank you very much.
Thank you very much, PHA. And it's really very good to see that you're actually incorporating 5S, not only making it something separate, it's something that is part of our day-to-day hospital management processes.
Yes.
So my next question is, how best can the 5S activities or the Kaizen activities be merged with these other IPC and then other activities that are already being practiced in the hospital, even waste segregation?
Yes.
So how are they involving them? How are you involving them maybe at the lower people, support staff, or even within the administration, or even the heads of departments?
Yes.
Yeah.
Thank you very much. In Naguru, we have committees at hospital level for 5S. We have a committee for quality improvement, we have committee for IPC, and we have committee for patient safety. However, below these committees, we have work improvement teams in different units of the hospital. And these focal persons in the weeks, they represent, there is a focal person for IPC, there is a focal person for patient safety, focal person for quality improvement, and 5S. All these sit together and they discuss the cross-cutting issues of the Kaizen activities. Then also, when we are planning for the various activities, services that are going to be offered, we ensure that the 5S and the Kaizen activities are part and parcel in the service delivery. There is no separation. For example, when conducting a procedure, the medical waste, such as the infectious waste, are put in one bin, the non-infectious waste are put in another bin, and then the sharps are also separate in another box. And at the end of the day, this activity, what the separation itself is addressing IPC, it's also addressing the 5S and also safety for both the clients and also the service providers. So all these are incorporated in one as the 5S and Kaizen activities. Even during the trainings and during the meetings, when we are discussing and training, we merge all these activities together. In our agenda, we have an agenda whereby we shall discuss the IPC. During the discussion of the IPC, 5S will come in and safety will come in. When we have an agenda for 5S, IPC, quality improvement, and safety will come in the discussion. We keep merging all this so that, because they are part and parcel and the chain, one item contributes to the other.
Thank you very much. So what tips do you give to other hospitals that are getting on board with the 5S, patient safety, Kaizen activities to ensure that they also learn how to fund these activities progressively as they manage their hospitals?
Yes. First of all, as they fund for the various activities, as Aria said, that when they are funding, they have to merge all. They have to change the mindset of the healthcare providers and the staff and all those key stakeholders in the service delivery of the hospital, which should be geared towards 5S and Kaizen practices in the service delivery processes. And also, they have to know that 5S and Kaizen practices are not unique to each other. They are all one. This is one advice that I'm giving, that they should not be separated. So someone who is in charge of IPC should not say that, you see, 5S is not part of the IPC, or safety is not part of the IPC. They should always ensure that they are merged together. And we also have to know that 5S and Kaizen activities have always been there, even at school, in different professions, medical school, nursing schools, and all the other medical and non-medical professions. We have always been told to be organized, organize ourselves, which is actually a 5S, and have an environment that is conducive, a safe environment. So this is something that we have to continue doing. We need to go back to where we are supposed to be and implement what we're supposed to do. And also management should ensure that the 5S and patient safety and quality improvement activities always move at the same level. They should not leave out one aspect behind as they are providing the services, as they are planning, as they are budgeting. All these things must always be put at the same level. And then also I advise that support supervision should be encouraged to see how far the units and the service delivery points are actually, how they are implementing the 5S and Kaizen activities. It's also important to come up with innovative ways, because in the era of inadequate resources, innovation is very, very necessary. At the end of the day, it will reduce waste, and also it will, we shall be able to identify other ways of actually managing the 5S and the Kaizen activities.